Welcome to today's podcast with myself, Omar, and Ramon. We're going to have, just a little chat about living with sickle cell and how it affects us. I mean, we might not dive into everything today, but
I think it's important to note that sickle cell is different for everyone. So what Omar might experience will be different to what I experience, to be different to what someone else might experience. But on the whole, a lot of the symptoms affect us in an adverse way. So just to put that out there so everyone understands.
yes, it does. And as Roman said, it does affect us differently. And for me, growing up, it was a different experience from Roman experience. So I want to kick it off today.
Well, what was your first memory of having sickle cell? When do you remember the first time you realized, or someone told you, or something happened to you to make you think something was wrong?
My first memory, I would say, is if I should go back to when I was in primary school, home one evening and waking up, I think midnight, with terrible cramps in my tummy and joint pain. Family rushed me to hospital and and then this was about, I would say 7, 8 years old. Family rushed me to hospital and I was in hospital for many weeks.
Did they know then that it was sickle cell, or they just thought you?
Yeah, I always, and my parents knew from day one that I've got sickle cell. So my dad's side of family, let's say a little bit affluent compared to my mom's side. So my grandmother from my dad's side decided to take me in and look after me because my mom's side wasn't that financially to help me out
Yeah.
and give me the best care. Now, as I said, my grandmother, she does her best for me, medically and financially is there for me. To your question, yes, I did know from early. My parents did know, but we have to make a decision where was the best place for me to live to get the best support and medical help.
You could get. Yeah. For me, we didn't know immediately that I had sickle cell. But I was a very crying baby, my mom would say. So one time they took me to the hospital. I think I was about 9 months old, and wouldn't stop crying. So I think the doctor said, just by chance, let's do this test, because at the time it wasn't done as one of the standard blood tests. You checked for it as and when something crops up. So
That's true, and that's something I could say about what happened to us in Jamaica growing up. This wasn't a standard test that was done, and we weren't told from day one that we will be tested for sickle cell. It's just by growing up and having the crisis or the symptoms that come with it, then we know we got sickle. So yes, continue.
yeah, they did the test just off chance, and the doctor was like, "Oh, you might be having a crisis because he's got sickle cell." My mom was immediately confused because she didn't have any idea of what sickle cell was. There was no awareness, there was no information about it beforehand. So when the doctor said it, you know, eventually I started feeling better and I got taken home, and my mom did her research and she spoke to people, and she got a bit more information about what sickle cell was, and it turned out my grandmother had the disease but it didn't bother her. It turned out that my dad had the trait, my granddad had the trait by my mom's side, and so my mom had the trait as well.
So there was a lot of tests done then, and you had a lot of not at the time, but since you come to realization, you know there was a lot of information passed from early stage that you have that sickle cell disease.
It was, so I think the reason that my grandmother knew she had the sickle cell disease is that she was unwell at one point, and it wasn't when she was young, it was when she was an adult, and they did a test because I think she needed to get some blood. And one of the screens when you're getting transfused is that you have to check if there are any diseases that might make someone's condition worse. So that's how they found out that she had the disease, but it didn't really affect her severely. So she didn't take any precautions. There wasn't anything extra for her to do. She just carried on.
So, before we even dive too far into, the crisis that you experience, I've experienced, maybe we should let the viewers know what is sickle cell and how do we get sickle cell disease?
Yeah, sickle cell is I'm gonna try and say the medical description of it. It's a congenital hereditary blood disorder that you can only get from your parents. So
Okay.
it's not something you can catch from exchange of fluids, by open wounds or anything like that. You can only inherit it from your parents.
And that's what a lot of people don't know. But you said it medically. Let's break it down to a little simplistically for those who are listening and may not understand all these medical terms. So let's say the normal viewers who are listening now and say, okay, so you've mentioned medically, but exactly what is sickle cell? And if I should answer the question, I'm going to say, okay, it's a blood disease inherited from my mom and my dad by either parent having.
So both parents have to have the trait, or both parents have to have sickle cell disease, the full disease. If they are, so sickle cell disease is broken down into SS or SC. The trait is only SC. If both parents have SS, then there's a high possibility that the child is going to have SS. However, if one parent has SC and another parent has SS, there's still a high possibility that the child is going to have SS. So what it means is that the dominant gene in the sickle cell is the SS gene, and that can be passed down easier than the SC gene.
Correct. Correct.
If a parent has a trait and another parent does not have the trait, then the child can only get the trait.
Okay. So probably another question then is, we have the disease, we know the symptoms, the crisis that comes with the disease. What about those people who have got the trait? What would you say about them? Because, for me living with the disease, I can tell it's unbearable. It's sometimes unbearable. So what about those people who might be listening and said, but I got sickle cell trait? A lot of taboos out there, or that you may have the trait and you can't catch malaria, and so on. So what you can say, what do you know about the trait?
All right, if we want to break down the concept behind malaria and sickle cell, we have to go back. So sickle cell was an evolutionary disorder. It came about because a lot of people in Africa were catching malaria, and the body's good, so it tries to break down a disease, a contagious disease, and make antibodies. So one of the things that they found is that a lot of people with the SC version of sickle cell won't or are adverse to catching malaria, so their body fights better against it. Now, it can happen with people with SS, but it's less likely for people with SS to be able to combat malaria. So you can still get malaria, but your body defense is better with it when you have SC.
When you have SC, okay. So those people who are watching and those who got sickle cell trait, there, as you hear, if you got the trait, it's a possibility, depending on what variant you have, you can be immune from the malaria. Now, we are going to focus a little bit more on the sickle cell disease. So,
Just before we move on though, the experience that I've seen from people with SC is varied. It varies as much as people with SS. So some people with the trait, they might not experience any crises or any bad effects, but there are some people with the trait that do experience the breakdowns and the crises and exhaustion and whatever comes with the condition.
okay. Okay. So, again, we're not really going to focus too much on the trait, even though it is relevant, those who have got the trait. And it's also good to know, if you have the trait, the partner that you will choose, and that goes later on in the episode. So it's good to know about the trait, but let's not too focus on it at this minute. But growing up with sickle cell disease, how it affects us growing up, and for me, I don't mind start this one off. For me, it affects me mentally in a bad way. When I say mentally, I didn't have the parent, I didn't have the support network, I didn't have all those people around me to say, this is what sickle cell is. At the time, it was only me in the family, I would say, have the disease. So, again, I didn't have a companion to, share my story with, and my crisis, my cousins and so forth, as much as they were close to me, is nothing I could discuss with them, because their situation is different from my situation. They're living a normal life. Most of my time, I'm in hospital for whatever symptoms.
Okay. What would you say is your favorite childhood memory of being able to talk to someone about it? Have you got one of those, or was it when you were an adult?
Childhood moment. I wouldn't say I've got a favorite. I wouldn't got a childhood moment where I say I used to talk to people about it. To me, it was almost like a disease I was trying to hide, not want to talk about,
Yeah.
because I always know and feel within myself I am different from them.
Yeah. Yeah.
And because I never had the companion or the mother or father around me to say, this is why growing up, I was always skinny. And I always thought, probably it's because I got sickle cell. Maybe it's just in my gene anyway, because my dad is slim. But, going to school, my eyes always jaundiced. So my friends used to like, why are your eyes so yellow? I can't have an explanation for them. I could only say I've got jaundice. Why I got jaundice? Because I got sickle cell, and that's as much as I can say. What is sickle cell? Didn't really know much to say at the time. So for me, growing up, my childhood moment wasn't the best.
Yeah. Yeah.
And
So as an adult, what was your opportunity to open up and talk to someone and say, you know what, this is it? Who was that person, firstly? Who was the first person you opened up to?
to be honest, turning into an adult, the first person I would say I talked to, you would expect it to be my wife, but not. Vaguely, my doctors know exactly what's happening with me, so I can relate to them when I go and have my consultation.
Yeah. Yeah.
So let's say they are the first people that I've gone into discussion about my sickle. Next, I would say, yeah, probably my partner, my wife. She never knew about the sickle cell disease. Early on, I think we probably just vaguely discussed it, and I never used to have all these crises. So it's like we just had a quick discussion over it, and we move on.
Okay.
So it wasn't like a in-depth discussion how it affects us, how does it affect us having children and so on. We didn't have that discussion.
Okay.
And I think for me, I should have.
Yeah. I think the earlier you start to have that conversation, the better. And I do think that my growing up is a little bit different to yours. I had a bit more knowledge, and it came a bit later than you because you were born, you knew you had sickle cell, and things kind of progressed from there. With me, it's only after 9 months, my mom found out that I had sickle cell, but she was the kind of person that she'd talk, she'd ask questions, she'd go about everywhere finding out information, and as soon as she had the information, she'd try and explain it to me at a young age so that I had as much information as I could to
And that's the difference. Yeah.
condition.
Yeah. That's the main difference. So, as you can see, we got different upbringing and how parents talk to us about this. Now, as I said, I don't want to stretch this one out too much, but maybe we could talk about some of the crises we've gone through, as there are many people living in, let's say approximately, I think figures are saying 15,000 Afro-Caribbean people living in the UK with sickle cell disease. In Jamaica, I can't say the numbers, neither for America. So there's quite a lot of people living with sickle cell, and it's affecting a lot. We could go into medication and how treatments work, but for now, we're just going to stick with a little bit of some of the crises we've been through. We can rotate it, whosoever want to start first, but, it's kind of good to say to those people out there that you are not the only one going through your sickle, and you are not in it alone. Because when I was growing up, I honestly think I was the only person going through this, until I've been to hospital and I might see someone else on the ward that has the sickle.
Yeah. I can go first with this one. So when I was young, yes, I knew I had sickle cell, but we didn't know the different ways it affected us. So, or I didn't know the different ways it affected me. So, as a child, you do play, you do whatever, but what usually happens is that due to exhaustion, due to dehydration, due to different issues, like after my day, I'd be curled up in bed with severe pains.
So hold on. Was this back in Jamaica or was this in the UK? Because,
Back in Jamaica.
okay, so for those who don't know, we both were born in Jamaica. I've moved to the UK probably 1999, and I'm not sure which year you moved to the UK, but, it was around this roughly around, not too long. So we're talking about early years back in Jamaica, and we know growing up in Jamaica, in the days outside is our playground. Yeah. Okay. So you just mentioned you had a, let's say, exhaustion day, and then after you curled up. You curled up because you're going through a crisis. You're going through pain.
So it like I said, my day always starts with activity. Whatever you're doing, you're a child, you run around, play, it's usually outside in Jamaica. So you run around, you play, you ride your bike, whatever it is. But then the evenings are usually a struggle for me because due to exhaustion, whether it's dehydration, whatever the case may be, my mum would say, "Oh, you've overexerted yourself," and that became a narrative going forward. Don't overexert yourself because you know what will happen. So, like you, it kind of became a taboo because you're consciously thinking about it while you're playing. That, oh, am I doing too much, or is this gonna affect me later on, or whatever.
So you always have the parents behind you to kind of remind you that you might, as a guideline.
Yeah.
And
but
then
also in your head,
yes,
have it as well because you know what happened the night before and you don't want it to happen again. So you take all the precautions to try and prevent it happening again. And that starts at a young age, and it builds in you. So even now as an adult, you think, "Ooh, should I do that? Or can I do that? Or will this affect me later on?" So you put things in place to try and avoid having a crisis.
Okay, okay. So that's how you deal with it. And for me, I was just like the one who just go out and play, care less about the sickness, and then when it comes on, it comes on. And that's how my approach was. I always kind of, if I have to go to the river, I go to the river. If I have to, whatever my friends are doing, I'm joining in. But when it comes to the crisis during the night or whenever it comes on, then that's when I deal with it. I never kind of have that in the back of my head to say, be careful, this might happen. Because, as I said, nobody was there talking to me about it.
Yeah,
So I never had that kind of consciousness always in the back of my mind, be careful of this or be careful of that. Just for, I'm normal. I'm just like everybody else, even though I know I'm not.
yeah, yeah.
Okay, okay. So that's some of the things you. So for me, over from those early play, and I think you touched base on it, and this is gonna go back into how I was brought up, how my discussion with my partner and others around me, how I start to talk about sickle cell, because for me it was always a kind of close tight, hold on, don't talk about it, keep it to yourself. I think I mentioned it earlier, went to school, get back home, wake up in the night, cramp killing my tummy area, so my joints, waist, knee, and that's one of the first signs for me knowing that I've got a crisis coming on. So you could feel the joints pain and all that.
So should we tell the audience what a crisis is?
Yeah, maybe, yeah, we should, because if we're going to talk about sickle cell, we already tell you what sickle cell is.
Yeah,
Let's
let's
go into
delve into
crisis.
what a crisis is. So a crisis is basically a high level of pain, and it usually starts off small and it escalates, and it's all over the body, or it's targeted in one area. So my experience of a crisis is it will start in my joints, and then it will move, and then it will land somewhere. So it starts off in my joints, it will move into my chest, and then it will stop in my back. That's the worst one I've had. And this means that it's paralytic, so you can't really move, you can't really explain how it feels, but I can kind of explain how the joint pain feels.
So on a level, let's say on a level of, let's say 0 to 10, pain level, what we're talking about?
All right, so it starts off at maybe 3.
So start off with 3.
Yeah, so in the joints, it's usually starts at 3, and then it moves around and it gets to about 7 before it then settles. And by the time it settles, it's like 8 or 9. And that's debilitating pain. You can't move, you can hardly talk.
Yeah.
All you have to do is take meds and try and sleep it off, or if they take it to the hospital.
That's my experience as well. And I would say the same. And when you mentioned the sleep off, as many a times I said to my partner, my wife, that, I'm in crisis, I just need my tablets and I'm going to bed.
Yeah.
And when I'm said I'm going to bed, I need to just curl up and just lie in bed. And if it get worse, then the ambulance will have to come and take me out of bed. So that's how bad a crisis is, and that's what a crisis is.
There was a study that that made a comparison between a woman giving labor and a sickle cell crisis, and they found it to be almost exactly the same level of pain. So that's just a comparison that you can use to imagine how painful
And it's,
crisis is.
would you say the pain is almost, for me, my experience is almost like a beating pain, boom, boom. And then sometimes it just levels out to like a continuous pain. But for me, every time it's like boom, it's like I try to tense with it,
Yeah.
and that's my experience as well. So the pain is unbearable. So for those who are going through and having this sickle cell crisis, I'm telling you, for the parents and the carers around, I can only say and sympathize for them who are dealing with us, because it's difficult. It is difficult and unbearable. So that's my experience. Crisis over the years, and I will touch one which is really, really close to me. And this is one of them that I honestly never really talk about. And I want to tell my wife about it after my after probably my second, third child. Just after I think, yeah, after my second or third child. This as I said, it was about 7, 8. Went to school that day, and get home, was in pain. They rushed me to hospital, and when I reached Mandeville Hospital in Jamaica, the doctors diagnosed there are symptoms that they call PRIAPISIM. And for you guys who are watching and probably know or don't know what a PRIAPISM is, it's when you have an erection or a blood. It's when you have an erection where excess blood flows to the penis, and it's swelling for many weeks. So mine was about 2 weeks, and doctors have to ice me down. My mom said, "Doctors, we're not gonna operate on my only son," because I was the only son for my mom. So that was one of my worst experience, and I could dive into this a little bit more in the series or into the next episode. Maybe when I'm here with my partner, we could talk about it a bit more. But that was one of my worst experience and crisis that I've been through. Other than the chest pain, the lungs infection, I would say that's my worst experience. And for that, it makes me so self-conscious that I don't even want to talk to people about it. And I don't know how many people out there who have been through or those who have been through that experience and don't know who to talk to, because my mom wasn't there. But as I said, I leave this for another episode. And if anything, we will continue and go into a little bit more about other crises that we've experienced. And I could dive a bit more into the PRIAPISM and what it is, how it affects me, and so on. Any final thoughts from you, Ramon?
I had an experience of PRIAPISM. That was one of the scariest things I've ever had, because you don't know what's happening, and I didn't know anything about it until I had it, and then they said, "Oh yeah, this can happen," and I was like, "Well, it would have been useful to know."
Yeah, and as I said, for me, this was 7, 8 years old.
Oh wow.
Very tender age. So again, you don't have the people around you to discuss what's going on. My mom passed away when I was 10. So after my mom made the decision, do not operate, she wasn't there to continue that support network for me.
Yeah.
Now I have to deal with this through teenage years until. But as I said, we could dive a little bit more into this later on, and I'm sure we're gonna have a lot more episodes. So for now, we're gonna leave it there, and we will continue on episode 2. But today was just a chat about sickle cell and how it affects us. Yeah.
Yeah.
Okay. So for now, peace out, and we catch you on the next one.